Hey y'all, we're gonna go through the brain parameters. This is not for every facility is different, but ideally, this is the overall submission of a head CT scan. So when we do the first scan, it's gonna be a lateral scout. So that's just an overview view of the head. So the patient's going to go in head first. And some machines does give you a lateral and an AP view, but not all. This machine gives a lateral scout. This is a Philips. It's a brain without Philips scanner, brain without. It is normally head first. So we'll bring them head first. That's how we put them in the table. And then we'll either go chin or top of the head, depending on what it is. The Philips only comes outwards. It only scans with the patient coming out. So we do have to scan the patient start the 0 at the chin. So when you put the patient in, 0 the inside light of the gantry to their chin. And then that way the patient will come out and the head will be scanned. So once we get their lateral view, again, make sure everything is isocentered. So the line is in the EAM. The lateral axial line is in the EAM, which is near the ear, well, in the ear hole. And then the sagittal line, when you do the lining up here, so the EAM is going to be here on the axial, and then if the person is facing you, that top light is going to hit like their nose or their mid sagittal line, so like between their eyebrows, their nose, and their mouth. So you want them isocentered, chin down, so the orbits is out of the way and you don't have to tilt much. So just bring their chin down. Okay, so brain. This is a brain without contrast. Doctors normally order this when they're concerned for a head bleed or any trauma. They want to see if there's any broken bones, any bleeds, strokes. Always a brain without. So when it does a reconstruction, it's going to do an axial of 5x5, a soft tissue brain window, and then a bone window of 5x5, and then we're going to have a soft tissue brain window of coronal and sagittal, and that's also 5x5. When they do the table length, it's only this portion of it, so from top of the head to about the base of the skull. It doesn't need to be very long. So the scan length is about 140. Just to give a reference, from like top of the chest to pelvis is about 600 or so millimeters length. That's how long the scout's gonna be. That's what that means. And it's defaulted to 120 kV. Mass is 375. And of course, this all changes. So the scouts for 140 length, it's gonna be 6.8 seconds coming out. So that's kind of like the pitch. And this is just an ideal number. It's nothing yet because we have nothing scanned. And then, so again, this is just the parameters of it. All the slices here, it does come with a volume, and that's 1 by 1. This is the technique that it uses initially. And this is a time it moves for, but this all changes. This all changes once the patient actually gets scanned. So the axial right here, this is an axial view, axial, coronal view, and sagittal view. And like I said, its thickness and increments is 5x5. The filter, this is the brain window. For Philips, this means it's the bone window. Brain window, brain window. And that's pretty much for the head. Let's see what this says. So this is just an overview of what it was in. So KV 120, everything that it says. We can change this to be longer or shorter depending on the table length that we want. The machine comes out, the Phillips always comes out, even though it has in, it doesn't do that. And everything's just the same. This is the pitch, rotation time, all this intertwines, and that's the gist of the parameters for Brain Without. Toodles noodles.